Good morning, my dear doctors, friends. I take this opportunity to thank Dr. Sendil for having encouraged me over a period of maybe 4 or 5 years to come and discuss the nuances of healthcare marketing with this wonderful group of doctors. I hereby express my gratitude and thanks to all the participants across the globe in this wonderful platform, Ophthall. Thereby, we are able to exchange ideas and to gain knowledge. So, thank you very much for the opportunity for each and every one of the members of this wonderful group. Today, I would like to continue the hospital marketing topic, which is very close to my heart. That is the first conference where I talked about the marketing myopia. So this is the right situation. I strongly feel that amongst the pandemic or at the end of the pandemic in the international arena, we need to discuss and set our goals towards the future. And the famous mantra I always say is that the money or the revenue comes through only sales and marketing. The most important aspect of any business is revenue generation. And the revenue generation is possible only through the strategic approach towards the sales and marketing. So I have been always discussing about the difference between sales and marketing. Let me touch upon a little bit on this particular aspect. The sales is the one which drive the numbers. For example, the conversion levers or the day-to-day footfalls which we get through various activities. This is the sales. The marketing, which has got various aspects. One is the branding, and the number two is that the media at which what we are doing about that. Various, we call us that the bundle of activities what we do, the visibility game generally. So the sales is the one which all depends on the efficiency of the hospital staff in conveying, in working in conjunction with the doctors. For example, when a patient comes to the hospital, when the doctor advises them that they need a LASIK surgery or they need a cataract, always there is a doubt, there is a confusion in the minds of the patient. What is next? They would like to consult the near and dear and their relatives. So at this particular point of time, the role of the service line managers always say that, which is very important, whether you call them as a counselors or whatever name, but they are all called as service line managers. They have very good knowledge about the procedures and also socio-economic conditions of the particular place. We have got hospitals situated across the globe, whether it is in the cities or maybe in the semi-urban area or in the rural areas. It all depends on the socio-economic conditions of the place. So the service line manager should have a thorough knowledge about the socio-economic political situation of the place and should be in a position to convince the patient. Today, the technology has developed so much. Each and every doctor, each and every organization is capable of performing the normal surgeries. Maybe some high-end surgery, something like aculoplasty and all, maybe you need a bigger facility. Otherwise, due to the technological advancement and the high-end equipments, this is possible. So this is pure sales. The marketing is the one, there comes a major important question. What are all the marketing activities you talk about that? That's what I call as a myopia. What is to be done? So the famous mantra is that please identify your market potential. How much we are going to plan, that is a business plan, and how are you going to approach the market? Number two, once you decide, yes, this is the market potential, I can do 5,000 cataracts and refractive surgeries maybe 3,000 per month. Then please look into the penetration level. If the market is capable of doing 10,000 cataract through camps or all these methods, how much you are going to plan for this year, then divide into number of months. How much you are going to do? That we call as a market penetration. Yes, I am going to do 10%, 20%, 30% like that. Once you decide the market penetration, then keep the eye on your target audience. Where you are going to concentrate? You are going to concentrate on the elderly by the camp, or you are going to concentrate on the public sector employees, or you are going to concentrate on the students or the children or the diabetic patient. This is your target audience. Once your target audience is ready, then you need to have your strategies, the plan of action. How are we going to do that? Then this strategy, what we are planning, it should get aligned with your facility and with your strength. And also you need to develop KOL, we call key opinion leaders. Maybe they are GPs, there may be bank managers, or they may be some politicians. They are the key opinion leaders who talks in favor of your institution based on the experience what they had with you. So this is very important. Once you decide, yeah, this is my strategy, which are all the ways you are going to approach. The simple, straightforward approach is that we call as marketing communication aids. We call as that comprehensive communication aids. First, it starts from the leave behind literatures. How are we going to do that? And second one is that the conventional method, conducting camps and meeting them regularly. These are all the things. Then what is today? The conventional methods are not going to work. It's going to be very tough. Maybe down the line, 1 or 2 years, the mass campaigning, meeting the people, conducting the camp, posters, banners, and all, it's going to take time. It's money consuming. So the best option is digital. So what the marketing experts, what they say about the healthcare, how it is going to go. There are 4 aspects. Number one, the big data, which is going to play a major role. The data means the patient data, what you have, number one, and also the data, what you can get through your websites or whatever you have. Number 2 is that artificial intelligence, which is going to play a major role. Everywhere we talk about artificial intelligence, people say that this is going to play a major in all the areas. Then machine learning, it's a part of artificial intelligence. Machine learning is one of the important things. Business analytics, how are we going to analyze the trend, the footfalls, and the areas at which we are getting. So this has to be done. Then we call this a blockchains. Blockchains are generally, it is associated with supply chain management, but we are talking big in today's marketing area. How are we going to do that? These 4 areas are absolutely important. How are we going to go about that? Then I always say that when you divide your target, keep it in that way. What is the cash? What is the TPA? What is the corporate? Then how much you are going to concentrate on your international marketing. So align these pair mix along with the goals, or the strategies what you are going to have. How are we going to go in all these things? Big data is going to be most important. Your customers are very, very important. So these customers, how are we going to do that? I will give a small example. A guest comes to us for a cataract surgery. The patient is already having diabetes. So they come to the hospital and they ask for that. How are we going to keep the patient with us forever? See, today, any multi-specialty hospital, we get referral from all the doctors. The orthopedicians are referring for cataract surgeries. The ophthalmologist, they are referring for cardiothoracic surgeries. And many times we get, like ophthalmologist referring the patient for renal surgeries or kidney replacement or dialysis, because we are going one step ahead, because in the part of the body, everything is interconnected. When diabetes comes, each and every part of the body is going to get affected. So have a comprehensive approach. So there comes, Dr. Senthil has been talking about the group practice, where you will be in a position, number one, when the patient requires higher center or maybe advanced treatment, you can refer amongst your group. Number 2, if the patient, when you identify that he has got comorbid conditions, or he has got lifestyle disorders, or he has got other complications, definitely you can send the patient there. But always the first point of reference, or the referring physician, will be the doctor who has referred the patient. So this is something like a family physician concept. They are going to again come back to you. This bonding is absolutely required at this particular point of time. See, today the supermarket, how it has been developed, the malls are how it is developed. The single solution wherever you go. I still remember where I worked in a tier 2 city where I was working for a hospital, we had multi-speciality, but cancer specialty was not there. Maybe something else, maybe the high-end ophthalmic treatment was not there. So then we decided that it should be the single point of contact. Whenever they come, everything should be available. Once you come into the campus, everything should be available. Similarly, the patient or the customer should get the feeling that yes, if I go to my doctor, he is going to advise me in various ways. What is going to be my general health conditions? Please start developing something called a general health checkup, something like that. The days have gone that general health checkup is only with the specialty hospital. Anybody can do that. You need only a physician, maybe the lab test, what we need to do that. Many times when the patient goes for one, for example, eye or dental or ENT treatment, they don't go for the master checkup. They take some basic tests. Only when the problem comes, they go. Take this opportunity. Advise them that how they can utilize this. So the bonding is developed between the patient and the doctor, so that it will be very good for them to do it. So then one important thing is that today the visual media are playing a major role. The visual media can be done through either by the TV advertisement or the programs, maybe weekly programs or during the news channels. Or the most important aspect is that you can run a particular program every Saturday, every Friday. It all depends on your marketing budget, how much you want to do. As I said, the market potential, the market penetration, then what is the share I am expecting in this present scenario, how much budget. I always say 5% should be your marketing budget on the turnover. For example, if I do 1 crore in a month, I do 5 lakhs, which is a minimum. You can do that, but according to the need. For example, we always say which is the good month for surgeries: April, May, June, in normal circumstances. In this month, allocate more budget, then start doing more activities. With this, you will be able to get that. So we talked about 2-3 things: sales, the service line managers, the conversion levers, how are we going to do about it. Then in the marketing, their approach, market potential, the penetration level, and the target audience, how are we going to do that. Then when we talked about that, which are all the activities we can do, as I said, apart from these 4 major things, the virtual things you can start. The virtual OPD, as I have been pointing out that many leading hospitals, 70-80% of the consultations you are getting virtual. All the IT companies, nowadays you see that offices are being closed. A lot of money has been saved, and the transportation time is saved, and then the canteens, the coffees, the electricity bills, everything has come. We need to look at it in a different way in the post-pandemic, at least for the next 3 to 5 years, in order to focus our business and in order to float on the top and retain our margins, at least to a certain extent, whatever is possible. So in the marketing, one of the most important aspect, which I would say, is that your website. Please make a website interactive. Today, there are some people, I know that one of my friend who is doing interactive website in a very big way. Your website should talk. Nobody stays in a website for more than maybe 30 seconds or 20 seconds. They keep on moving that. When you go there, what happens is that most of the websites, they want to give everything in the first look. When you go to the first page, everything is available there. Please don't make it like that. Make it absolutely interactive. Guide the customer whenever they go, where they have to go. Maybe when they go, what are the common eye problems? Yes, I have this eye problem. Then immediately comes to the mind is who is the doctor? Then talk about the doctor and his qualification. All these things. The most important thing is that patient testimonials. And please follow all the legal norms before getting the testimonials. Get the patient acceptance both in writing and also in the video, stating you get their acceptance, then start doing it. These small videos will play a major role. Try to have more and more videos, the patient testimonials, which will help, which will be of great help. Then the most important aspect I strongly feel in the website is that your search engine optimization. How easily you are going to put it. Please keep on adding it or changing it every month or once in 2 months. The correct words. It should be colloquial. Take some of your friends who are very common friends. You tell them that how you describe eye problem, maybe a glaucoma or maybe something, the dry eyes. How they explain that. Try to capture those words, especially when somebody is practicing the tier 2, tier 3 cities. This is very, very important. The search engine optimization, the key words what we are going to use. Number 2 is that the social media marketing in the website itself. How are we going to market? LinkedIn, you see that it's phenomenally doing well. I have been talking all along. Over a period of time, LinkedIn will overtake Facebook and also the YouTube. That's what's happening today. LinkedIn is a major thing. You can fill up all your vacancy through LinkedIn. You can connect all your patients through LinkedIn. You can do promotional activity through LinkedIn, which is economical and you can do very well. Then Facebook, all these things are there. Then try to post some live procedures where you do something extraordinary or you do something different there. Maybe many times I've seen the no, I've been doing thousands of surgeries in a month, what to do. But many things are important. I know one doctor who has done on a particular day some 30, 35 cataracts. We thought many people may be doing 40, 40 also. But he put it, then it has become a big, talking point that because how many common men know that 35 cataracts is possible in a single day? Example, I'm saying like this, any procedure you can do. So start thinking on these things. And once again, my request is that appoint a specialist, a consultant, or a person who knows the medical marketing, which is very important. It is not possible for everybody to do anything. That's why doctors are having many doctors or assistants with them. A doctor is capable of doing any surgery, but it is not possible because the focus will go off. So I would request that concentrate more on these areas, big data management. How are you going to, which are all the data you are going to provide in the website and which are all the data you are going to take and make it 24 hours on. Anytime when the patient calls, it should be there. Maybe you are today the interactive websites, they can immediately respond to the patient whenever the query comes. Then they can immediately morning, maybe 6 o'clock or 7 o'clock, your guest relation or your customer service department take a hold of it and do it. I'm telling you many times, 4 o'clock, patient has some discomfort. Immediately they feel that they have to go to the hospital. Then they think that I have to go for a muscle checkup for all my patients. In my hospital, many times I could see that in the morning 4:35, 10 or 20 people are asking for a muscle checkup. Start promoting that because the concept of muscle checkup is something very, very new or very rare in tier 3 cities, even in tier 2 cities. We should create an awareness. So in muscle checkup when they come, eye is the most important factor which they can do about that. So in the post-pandemic, we need to think differently. We have to act differently to get these things. Then insurance is the most important thing. Please improve your relationship with the insurance department. And if you are not empaneled, please get empaneled and try to understand everything. And also if GIPSA is available, what is the GIPSA? And we should also know the nuances. When you send for a pre-op, some amount comes, then again it gets reduced. Then again, sometimes it may get increased. So always there is a problem between the patient and the customer service department or the billing department regarding the tariff. You are telling something, why this is happening. Many times I could see that hospital tend to lose something. So please be clear. Again, have an expert in this. What is a GIPSA tariff? What is a regular tariff? What is the difference between the government insurance and the private insurance, and how to reach the international insurances? This is going to be the future because I always say that when I started my career, the cash used to dominate. When you see the collection, 70 to 80% of the revenue comes with the cash. And insurance was hardly 10%. International was nothing. And corporates directly they were sending the patient. Today the scenario is totally changed. 50 to 60% is insurance. Your master checkup is driven by insurance. Your campaigns are driven by insurance. Everything is insurance. It's going to be over a period of time. Insurance is going to play a major role. Then two insurances. One is that the insurance which the people take the policies, then the government one. What is the government one? And if you are able to leverage it and if you are able to get it, that is fantastic. And number two is the private insurance. How to get, empanel the private insurance. How to discuss. I'm telling you, the surgery wise, it is same. Whether it is a hospital, B hospital, C hospital, super duper specialty, multi specialty, everything, it is same. But maybe the ambience or maybe the equipment is different. But skill wise, at the end of the day, what the patient comfort, what they were going to get, it is going to be the same. So please negotiate with them very well to get a better price and exhibit your hospital, what you are having, what are the facilities you have, that we can do that. So I think with this, we have covered what is to be done in the future, how to use the digital media, and what are the things, how to train your staff for the conversion management in customer relationship, and also to develop the attitude of the belongingness. It is my hospital, it is my institution, and they are my patients. With this thing, we always say servitude. the service with a positive attitude, we can do the best. You can always reach me through the Ophthall and to Dr. Senthil. Thank you very much for the time. Have a great day and have a great future. Thank you very much.